Hi, everybody. I'm Crystal Haynes. Tonight on Greater Boston, the dire need for more support, mental and medical, for moms and their infants in this state. Two maternal health advocates join me on where we are failing and what lawmakers can do to help. Then the creator of the Cointelshow, a satirical inside look at the FBI's controversial surveillance program that tried to take down the civil rights movement. Massachusetts is considered a hub for world-class medicine, with some of the best hospitals in the country right here in Boston. But when it comes to the state's mothers and infants in particular, not everyone has access at the same level of care. Massachusetts was graded a B- when it comes to the rate of preterm births in the latest report card from advocacy group The March of Dimes. And black women in this state are faring even worse, rating a D grade, with 25% more preterm births than any other race. These grim statistics are urging some lawmakers in this state to act. The Moms Matter Act, which, if passed, would address maternal mental health and substance abuse disorders for pregnant and postpartum individuals, with a specific focus on those racial groups most severely impacted. It's also why representatives from the March of Dimes were at the State House today, meeting with lawmakers as part of the organization's March for Change to demand better health care for Massachusetts moms and babies. Two of those representatives, though advocates, they join me right now. Chloe Schwartz is the director of maternal and infant health with the March of Dimes, and Jessica Paulino is a doula, a maternal and infant health advocate, and founder of the EMA Project, an organization dedicated to helping babies and families navigate grief and neonatal loss. You know, we have to mention that Jessica lost her own son, Edward Manuel Arnold, 3 years ago today, just weeks after he was born prematurely at 24 weeks. I want to thank you both for your time.
Thank you so much, Crystal.
Thank you.
So let's start, Chloe, with the action that's been happening up on Beacon Hill today. What are the initiatives that you all are really pressing lawmakers to act on?
Absolutely, yeah. And we're not the only state doing this, but we call it March for Change, and it's when we bring together all of our dedicated volunteers across the country, and we go to our state lawmakers and we ask them to pass really important policy changes within maternal and infant health. So each state is a little bit different depending on where they are in certain categories. But for us locally, we have 6 policy priorities this session. A few of them fall under the maternal mental health and postpartum care category, namely the Moms Matter Act, as you previously mentioned. Also a bill that would incorporate postpartum depression screenings into pediatrician visits, because we know moms are going to those a lot more than they're going to their own postpartum visits, as well as a bill that would guarantee paid leave for pregnancy loss. And that bill is really interesting because pregnancy loss within that bill is defined not just as a miscarriage or a stillbirth, but also a failed adoption or a failed surrogacy match. So it's really inclusive of all of the different types of families that we see in Massachusetts and beyond. We're also advocating for certain vaccine policy, a longstanding priority for March of Dimes. It ties back to our very founding 85 years ago. And doulas. Doulas are a huge resource when it comes to the pregnancy and postpartum journey. And we want to make sure that Medicaid and other insurers are covering that kind of service.
And Jessica, this is a very special day. I imagine also a bittersweet day for you and your family. Tell us a little bit about your EMA, or I know you call Edward your sunshine.
That's right. So yes, my sunshine transitioned 3 years ago today. And it felt just really powerful to honor him in this way, to create a project around his honor and his legacy, that he's impacting families, beyond his birth and his death. Being in the State House today feels like a real full circle moment. I remember as I was going through, my experience in the NICU, him having lived for 22 days and then his transition, how much I thought about the dignity within those moments and how to honor his memory. I received exceptional care at Yale New Haven Children's Hospital and felt very loved and nurtured through that process while I was there. Also was, exposed to the March of Dimes at that time. I had heard of the organization, but didn't have any personal ties to it. And they do a great job of having NICU coordinators who come to the floor to provide education, to provide advocacy. And all of those experiences fueled me to create this project, specifically to support bereaved families, not just with infant and pregnancy loss, but also embryo loss, which I also experienced. And the complexity of grief within that, the complexity of like being a postpartum person without a baby home, that I wasn't necessarily seen as like a postpartum mom at that time. Those were the challenges that I was facing. And so it's become really important to me to advocate. I am one of the organizations that is supporting the Moms Act. I am so thrilled to have been at the State House today advocating for other bills as well, including the perinatal mental health that's part of the Moms Act, and the leave, which, as Chloe mentioned, just addresses a constellation of families that we see. We're living in modern times, right? Families aren't just made through birth. Families aren't just made there's so many ways to become a parent that all of those things need to be addressed because there's loss that can be associated with all of that.
We spoke about the statistics for Black, Latina, brown women, Native American rates, I know, has gone up when we're talking about maternal mortality and infant mortality. How do some of these actions address these outcomes? Because we know that Black women specifically, and this statistic has been out there for years, are dying at 3 times the rate of their white counterparts.
Yeah, I mean, with the Moms Care Act, I think the great thing about it is the fact that there are grants that will be provided to organizations to have a more inclusive workforce, right? So that people like me and brown and Black people in general can have access to care from providers that look like them, that have a lived experience like they have, and a cultural experience, right? It's really important to identify with people that may know just the impact of, truthfully, the health inequities and racisms that we carry every day with us.
Chloe, I'd love for you to speak on that too, as well as what the March of Dimes is doing.
I just wanted to add to Jessica's already very insightful knowledge there that we know that mental health is the leading cause of maternal death, not just in Massachusetts, but across the country. And what that means is those deaths are entirely preventable. And the issue there is making sure that moms are being heard when they're raising concerns about how they feel, not just postpartum, but throughout their pregnancy journey, and then making sure that they can access those resources. They know where to find those resources. They know what resources are available to them in their geographic location, their insurance status, and making those as widely accessible as possible.
Yeah, and as we talk about, especially that mental health piece, we obviously had this tragic situation with the Clancy family and the care that was there, and we know that that's being adjudicated in the courts. And you talk about preventable. I think about cases like that where perhaps access to different mental health care, different trainings and things like that would have made a difference.
Absolutely. I obviously can't speak to the Clancy case specifically. I wish them so well. But it is an absolute shame that it had to come to that for this to receive the attention that it is receiving. And it's unfortunately not a unique story. We've seen it before. And it is preventable. There are signs, there are resources available to, provide these families with, the help that they need. And unfortunately, the signs and symptoms often go ignored or disregarded entirely.
I know infant loss, and there was recent data and studies that came out recently about the rates of the mortality rates around infants. And so talk to me about how that changed, because we know that moms have been dying, but it seems like the rate of infant mortality is also changing in this state here.
Yeah, absolutely. So the leading cause of infant mortality in Massachusetts is and continues to be preterm birth, which is something that March of Dimes has been focused on for decades. And, we don't necessarily know what is the driving cause of the rise in preterm birth that we've seen throughout the years and throughout the country. But we know that there are certain risk factors. And we know that those risk factors don't come to light if moms are not getting adequate prenatal care. And that's a huge issue that we see across the country as well. Those reports of, adequate versus inadequate prenatal care are drastically lower than we want to see. And so making sure that access to care is, a top priority, and avoiding what we're seeing, which is an increase in what we call maternity care deserts, which are geographic areas that have little to no obstetric or prenatal care in any way, shape, or form, whether that's through an OBGYN, a physician, or through a certified nurse midwife, or any type of care available. Those maternity care deserts are on the rise across the country.
And Jessica, as you and other advocates fight with the March of Dimes to make sure that moms and babies are saved, I'm sure your son is on your mind today, and your organization does a very special thing in helping families, parents, moms, birthing people with dealing with grief and loss. And I'd love for you to talk to folks about that, because as you and I have spoken before, there can be a code of silence in some culture groups.
That's why I do what I do, right? Like I experience it even, from people that I know that love me, right? But that truly just wanted me to stop talking about my son, right? And so it's become super important to me to create a safe space for people to know that they don't have to go through this alone. There are people out there that understand, that want to hold space for you, that allow you to name your children, that allow you to name that loss, right? And to coexist within the love and the grief that you've experienced. I do hikes, community hikes, and hold space individually with people that have lost children. Specifically, mostly moms are the ones that reach out to me. And I can't tell you the amount of times that I've shared my personal story and then received that private message, on social media that says, hey, I'm so grateful that you shared this. I'm unable to share. I don't feel comfortable being this public about my grief, but you have helped me by being so public with yours. And I'll say, that has been the biggest thing for me the last 3 years, that I have shared very publicly when I'm well and when I'm not. And today being such an important day for me that, it marks his 3-year anniversary of his passing, and feeling just so empowered to be here, to communicate these messages, to tell our lawmakers, listen, we're dying out here. Our babies are dying, and these things can be preventable. I'm an educated woman who has obviously not an issue like speaking out, and I didn't feel heard in my maternity care. And I live in the mecca of healthcare, right? And education. And so if it's happening to me, it's happening to other families. It's really important for me to tap into immigrant families. I will be starting some free grief support groups in the Jamaica Plain area within the next few months. So I hope that everyone follows the EMA Project. I'll be sharing that information freely, and the groups will be both in English and Spanish.
And this question is for both of you. If you are a mom or a birthing person that's entering this space, what advice do you have to those folks right now as you all fight on Beacon Hill? And while that fight continues, what advice do you have to the folks at home?
Hire a doula. Hire a doula. Listen, if you cannot afford a doula and you're on Medicaid will cover your doula. There are companies out here who I do community work through, a company doula. They're specifically for mass health patients. Doulas are provided free of cost to them. It is important for you to have someone that is solely on your team and ready to advocate for you, or at least empower you to make good decisions for both yourself and your baby. Doulas actually lower the risk of a cesarean section by up to 30%. And, I've experienced being in the birthing room and advocating for my patients when they're being told that certain things need to happen, when in reality, the hospital's just trying to move you through their system, but the body needs what it needs to feel safe and to give birth.
Chloe?
Absolutely. I would echo that. Those are such a huge resource. And I would just say, remember that it takes a village. And we used to have a village, and we don't live in that world anymore. We have certain networks that we can tap into. I encourage everyone to tap into their entire network, whatever that looks like for them, and visit resources like marchofdimes.org or like the EMA Project when you're in a certain situation and you need that community resource. We are not the only organization doing this work. There are quite a few out there, and they are incredible. Lean on those networks, lean on those communities. We're here for you.
All right, well, ladies, I appreciate your time. Chloe Schwartz, Jessica Paulino, thank you so much for the work that you're doing and for talking to us about it.
Thank you so much.
All right, next up, you may not have read about it in your high school history books. It certainly wasn't covered in mine, but you can find the true story of the decades-long FBI program to undermine the fight for civil rights on display in the latest production at ArtsEmerson. Cointelshow takes a satirical look at COINTELPRO. That is short for Co-Intelligence Program. That's the FBI's covert and illegal operation aimed at discrediting and neutralizing figures like Dr. Martin Luther King Jr., Fred Hampton, and organizations like the Black Panther Party.
My name is Special Agent Christian White. You can call me Chris. I'm with the Public Relations Subdivision of the FBI.
In Cointelshow, the fictional Agent White takes the audience on a tour of the program's most dark and duplicitous tactics. I'm joined now by the show's creator, L.M. Bogad, who is also a professor of political performance at UC Davis. Thank you so much.
Thank you so much, Crystal. Thanks for having me.
So talk to me about the concept for this show, because, it's a topic that a lot of folks don't necessarily know about. And it also does something very unique on stage and in a virtual space as well.
Yeah, I mean, it's based on the actual nonfiction texts, the documents that were declassified by the FBI about these programs. So programs that were designed, in their own words, to disrupt the activities of social movement organizations. So it is a satire. It is, there's some grim humor in the piece, but it does have humor to help us to deal with this very grim history.
And so is the idea, I imagine the idea is to both educate and entertain, but is it education first and then entertainment as you go, or how is the design there?
Yeah, I mean, that's like the key question.
Yeah.
Thank you for that. It's like the way I was taught, if you're not entertaining folks, you're sinking. It's not going to work. And so it is entertainment first. And there's a lot of humor there. There's some surprises. The documents themselves are surprising. In some ways, unintentionally, the FBI wrote a lot of comedy. It's not the kind of comedy I would choose, but sometimes what they were doing was so unfortunate that you just have to laugh. And sometimes you have to take a situation seriously enough to laugh at it. And that's the approach with this show. It's all based in fact, but it takes you on a journey. The script is designed to take you on a journey through these documents and also to reflect on, well, what would I have done if these tactics were used on me? And how can we, to be productive, how can we resist these kinds of divide and conquer tactics? So hopefully to just make people more aware of the possibility of these misdeeds.
Talk to me about the research process for a show like this, because I imagine it's intensive and probably took a while.
Oh yeah. I mean, in fact, part of, as I was researching COINTELPRO, was very interesting. A lot of documents had come out in one way or another. And frankly, I had been involved in some creative, nonviolent, very peaceful activist groups that had been spied on and had been infiltrated in some cases. And we were like, what was that about? And this is after the time of actual COINTELPRO. But that got me interested in the subject matter. And then as I started to read these documents from the 60s and 70s, and even the 50s in some cases, I was like, oh, this explains the pattern. And we have to be careful. The question of who watches the watchmen is never going to go away. As people in a society that is trying to preserve our democracy and our civil society, we're always going to have to ask those questions and do our homework in that sense. So for myself, it was my personal experience, and then also reading up on the documents and trying to find the patterns. And some of the patterns I found were absolutely about divide and conquer, sadly making people suspect each other instead of trust each other to disrupt movements. And then I found one document that was released in compliance with the Freedom of Information Act. So they're like, okay, we got to release this, but they had redacted or blacked out every single word. And then they released it in compliance with the Freedom of Information Act. And I said, okay, I've got a show. Now I've got, because that's ridiculous, but it's ridiculous in a way that teaches us something. And for those of you who come to the show, that completely redacted or censored document is one of the stars of the show.
So I'm thoughtful about how you chose maybe the folks or the subjects that are in the show. We know Dr. Martin Luther King was surveilled. I'm thinking about Malcolm X. We talked about Fred Hampton from the Black Panther Party. I know about, actors and actresses that were surveilled. I mean, how do you choose from this plethora of very interesting and high-profile folks that we know were surveilled by the federal government?
It's a great question. Thanks, Crystal. It's very hard, especially for a piece that's not going to be 17 hours. You know, I'm a big believer in we're not trying to do with a theater play what an essay would do or a full-length 300-page book, right? So you've got to pick some folks that really give you an idea of the scope of these programs without trying to tell every story. So yes, Dr. King was absolutely targeted by J. Edgar Hoover, as we now know from some commercial films that have come out, right? Which is great. That showed how Hoover was obsessed with King not in a good way. And that was really unfortunate. And so we definitely spent some time with Dr. King on this. And then unfortunately, Fred Hampton, this very young leader of the Black Panther Party in Chicago, who was killed. And so these are important aspects of American history. We have to be grown-ups and face it, and I think those were some of the reasons why I picked some examples. And then I hope it inspires folks after seeing this short and, again, grimly entertaining play that does have humor with it. Well, then go and check it out for yourself. It's not hard to learn more anymore. Now you can go online and you can find out a lot. So fill out your knowledge after seeing the show.
LM, we actually have a clip from the show I want to play for folks, if we can insert that here.
Here's one we wrote as if from a union worker to a union boss to get the Teamsters, and more importantly, any gangsters they might know, up in arms against the Communist Party of America. I'm afraid these commies mean business, so watch out. Thanks to use of a free copy machine, I can get the word out about this. Don't let the commies take over.
So talk to me about this clip having to do with the Teamsters and the Communist Party of America, supposedly.
Well, first of all, I want to give a shout out to Bruce France, the wonderful actor, and Mondo Bizarro, my dear friends of the theater company that done this, and ArtsEmerson for hosting and producing the show. I'm very grateful. But that is a very real campaign that Hoover approved called Operation Hoodwink, which is an unfortunate pun. And they were trying to get to encourage through anonymous letters to encourage members of Cosa Nostra to take action against members of the Teamsters, which is not what our tax money should be paying for. And to go after members of the Communist Party who were working with and within the Teamsters, I should say, to be more specific. The Communist Party wasn't, we now know, as much of a threat as they made it out to be. It was a very small group of people, some of whom, or quite a large number of whom, were FBI agents that were infiltrators. Nevertheless, Hoover was encouraging through these anonymous letters sent by FBI, it's original creative writing by FBI authors who maybe should have tried to write their own, novels or something outside of security work, but they were written and then received by members of the Teamsters who were believed to be connected to gangsters, to encourage them to get violent with members of this Communist Party, this little small party that we have. This is really unfortunate, and it's not the kind of activity I would hope the state would be sponsoring with our tax money.
This show is a live virtual format. And so how was it different in terms of, staging, but also giving audiences that experience?
Yeah, I mean, we encourage folks to discuss and converse in the chat and respond to what's happening. Of course, there's conversation after the show, but even beforehand, as I don't want to give anything away, but there's an interactive series of chat rooms on the Zoom where you can meet the special agent. You can talk to each other. You're asked to surveil each other. Please be compliant and surveil other members of the audience. And so we're having fun with it and we're being tongue in cheek, but we're referring to actual practices where people are encouraged to be divided against each other, unfortunately. So that's the idea. In the live performance, this is a Zoom only show. In the live performance, we do similar types of activities to, again, have a little bit of fun with it. But in the on the way into the show, you might be processed by an agent in the lobby before you can get in. And they might ask you some personal questions you don't want to answer before you can get into the theater. That kind of a thing where you have to make a choice between convenience or being delayed. Either I give you some personal information where it takes longer to get into the theater. I know this sounds annoying, but we're trying to have a little bit of fun with audience members before they go in. So again, that's the type of thing we do in the live show. The Zoom show, we want to give a playful experience that does refer to the idea that we live in a surveillance society and we should be aware of that and the trade-offs that come from convenience versus having privacy.
Well, education, entertainment, virtual options. Seems like this show has it all. LM Bogad, I want to thank you so much for your time.
Thank you so much, Crystal. Appreciate it.
Cointelshow is running now through March 12th. You can find tickets for the live virtual performance at ArtsEmerson.org. That's it for tonight, but come back tomorrow for Talking Politics. Adam Riley and his panel will dig into the consequences if the Supreme Court tosses out the White House's plan to cancel student debt. Plus, political trailblazer Felix D'Arroyo looks back at 4 decades in public life. That and more tomorrow at 7. Thank you so much for watching. I'm Crystal Haynes. Good night.
And now it's time for our